invite our next presenter, Dr. Maham from Khan University Hospital, Pakistan.
Good evening, everyone. I'm Dr. Maham Khan from Maham Khan University Hospital, Karachi, and I'm really grateful to the Scientific Committee of AMSTRO for giving me the opportunity to present my work. So, our research paper is titled as Assessment of Radiation Dose and Volume Changes in the Masticatory Apparatus and Clinical Correlation with Trismus in Oral Cavity Cancer Patients. So, this is the outline of my presentation today. The objective was to investigate the radiation dose volume effects on the masticatory apparatus and to determine their correlation with trismus severity and muscle atrophy in patients who had oral cavity squamous cell carcinoma. So this was a prospective observational study at a tertiary care hospital in Karachi. So we had 30 patients who were undergoing adjuvant external beam radiotherapy for oral cavity squamous cell CA. So it was VMAT-based adjuvant radiotherapy. Patients who were undergoing adjuvant TBRT for oral cavity squamous cell cancer were included, and the patients who were undergoing re-RT were excluded. Patients who had flaps involving the masticatory apparatus, they were excluded from the study. So trismus was defined as in this study, it was defined as a limitation in the mouth opening. We measured the maximal incisor distance, and if it was less than 35 millimeters, so it was classified as trismus, and it was defined as a threshold that typically interfered with essential activities such as mastication, speech, and oral hygiene. And for this study, we categorized trismus into 4 groups. And the masticatory apparatus were defined as the bilateral masseter muscles, the medial and lateral pterygoid muscles, and the temporalis muscles. So these 3 groups of muscles. So the workflow of the study, we measured the maximal incisor distance. It was recorded to assess baseline trismus before the starting of radiation. Masticatory apparatus were contoured on the planning CT scan. Muscle volume was calculated for each of the muscles in CC. Mean radiation dose was extracted for each structure. Follow-up visit was scheduled 3 months after the completion of radiation. And then maximal incisor distance was measured again to evaluate the trismus progression from the baseline. Follow-up diagnostic CT scans were imported into the planning software, and masticatory apparatus were recontoured on the follow-up CT scan, and muscle volume was recalculated for each structure. So this was the workflow of our study. And to maintain the uniformity of the contouring of the masticatory apparatus, we used the study as a contouring atlas that we followed to contour the masticatory apparatus in the planning CT and in the follow-up CT. So these were the reference masticatory apparatus contours, and these are our contours. These images are attached just to give a reference of uniformity. So we had total 30 patients. Predominantly, they were male patients. The mean age was 51 years. The primary site was buccal mucosa in majority of the patients. Majority of these were left-sided tumors, and the most frequent stage was T4 disease. Radiation, 60% of the patients received 70 grain 35 fractions, and 40% received 66 and 33 fractions. And concurrent chemotherapy was administered to majority of the patients. So there was a statistically significant reduction in the mouth opening. So baseline trismus was 1.96 centimeter. Sorry, baseline mouth opening was 2.18 centimeters, and post-radiation, post 3 months of radiation, it increased to 1.96 centimeters post-treatment. So the muscles which received the highest radiation doses were the ipsilateral pterygoid, followed by masseter, and then the temporalis. So ipsilateral pterygoid received the most radiation doses. And all masticatory muscles had significant volume loss, and it was most in the ipsilateral temporalis. Radiation dose correlated significantly with volume reduction in the ipsilateral masseter, and patients who were older than 50, they experienced significantly most post-treatment trismus. So the ipsilateral masseter was the common denominator. It appeared in all three relationships. It received the highest ipsilateral dose, and it receives high ipsilateral dose. It showed dose-dependent atrophy, and atrophy was correlating with the worsening Trismus. So it was the key functional muscle in our study. So to conclude our study, radiotherapy leads to significant reduction in the maximal insider's distance, and ipsilateral masseter and temporalis muscles show the strongest association with functional decline. Age of greater than 50 years is associated with increased risk of trismus, and we need further prospective studies to define dose constraints and validate muscle sparing strategies. Thank you.
Thank you, Dr. Maham, for giving